A Stanford study has found that children who learned techniques such as deep breathing and yoga slept longer and better, even though the curriculum didn't instruct them in improving sleep. At-risk children gained more than an hour of sleep per night after participating in a mindfulness curriculum at their elementary schools. The research was published in the Journal of Clinical Sleep Medicine. The study is the first to use polysomnography techniques, which measure brain activity to assess how school-based mindfulness training changes children's sleep. The curriculum taught children how to relax and manage stress by focusing their attention on the present, but it did not instruct them on how to get more sleep. The children who received the curriculum slept on average 74 minutes more per night than they had before the intervention. Rapid eye movement sleep, which includes dreaming and helps consolidate memories, also lengthened in children who learned the techniques. They gained almost a half an hour of REM sleep. The researchers says that is really quite striking. There is theoretical, animal and human evidence to suggest it is a very important phase of sleep for neuronal development and for the development of cognitive and emotional function. Children in the study lived in two low-income, primarily Hispanic communities in the San Francisco Bay Area. One community received the intervention, the other served as the control. Both had high rates of crime and violence, and families faced such stresses as food insecurity and crowded, unstable housing. These conditions are a recipe for poor sleep. The study curriculum consisted of training in bringing one's attention to the present, exercises featuring slow, deep breathing, and yoga-based movement. Yoga instructors and the children's classroom teachers taught the curriculum twice a week for 2 years in all elementary and middle schools in the community that received the intervention. Instructors taught children what stress was and encouraged them to use the techniques to help them rest and relax, but they did not give any instruction on sleep improvement techniques such as maintaining consistent bedtimes. The instructors used the Pure Power curriculum developed by a non-profit called Pure Edge. It is available to schools for free in both Spanish and English. From the more than 1,000 third and fifth graders taking part in the study, the researchers recruited 58 children who received the curriculum and 57 children from the control group for 3 in-home sleep assessments conducted before the curriculum began, after 1 year and after 2 years. These assessments measured brain activity during sleep via a cap of electrodes placed on the child's head, as well as breathing and heart rates and blood oxygen levels. At the start of the study, researchers found that children in the control group slept 54 minutes more on average and had 15 minutes more REM sleep per night than children in the group that later received the training. Children in the control group were sleeping about 7.5 hours per night and those in the curriculum group about 6.6 hours per night. The researchers don't know why children in the two communities, despite similarities in income level and other demographics, had different average sleep times. But the two groups' sleep patterns evolved differently. Over the 2-year study period, among the children in the control group, total sleep declined by 63 minutes per night, while the minutes of REM sleep remained steady, in line with sleep reductions typically seen in later childhood and early adolescence. In contrast, the children who participated in the curriculum gained 74 minutes of total sleep and 24 minutes of REM sleep. The study's lead author says that it makes intuitive sense that children who didn't participate in the curriculum decreased their sleep. Older children are possibly staying up to do homework or talk or text with friends. Hormonal changes and brain development also contribute to changes in sleep at this age. The researchers say that still the average amount of sleep that study participants in both groups received was low, noting that at least 9 hours of sleep per night is recommended for healthy children. The researchers hypothesized that children might experience improvements in sleep via reductions in stress. However, the children who gained the most sleep during the study also reported increases in stress, perhaps because the curriculum helped them understand what stress was. Nevertheless, they slept better. The researchers plan to disseminate the findings more broadly, such as by helping school teachers deliver a similar curriculum. They also plan further studies to understand how various elements of the curriculum, such as exercises that promote deep, slow breathing, may change body functioning to enable better sleep.